Hello everyone. Today we will discuss about a short segment of pericarditis. Commonly, pericarditis indicates inflammation of the pericardium, and it will have the typical features which majority of us will be knowing. For example, chest pain which will increase on deep inspiration, increases on deep inspiration, and it will get relieved on sitting and bending forward, decreases on bending forward, and it will usually radiate to scapula and trapezius. So this will be the usual description of pericarditis related chest pain. But the confusion comes whether it is due to post-MI pericarditis or there is a separate entity called as Dressler syndrome. See here, the pattern of pain will be similar and the ECG findings. Commonly what we see in pericarditis, PR segment, depression and ST elevation in majority of the leads, and this ST elevation will be concave shaped, because usually in ST elevation MI it will be a convex shape of ST elevation. So these are the typical ECG findings in pericarditis, right? But how to differentiate these two? Here just understand that post MI pericarditis will be because of, see, whenever there is a transmural thrombus, this might irritate the surrounding layer of pericardium leading to pericarditis. So this is the mechanism. Whereas in Dressler syndrome what happens? Post MI after some time there will be release of myocardial antigens, and for these antigens our body will start fighting. So it will be a immune mediated mechanism, whereas it is just the irritation due to transmural thrombus. These are the mechanisms. So this irritation might be starting from the day 1 itself of MI, from the first day till up to 6 weeks, individuals might feel this kind of pericarditis. Whereas Dressler syndrome, being an immune mediated mechanism, it will take quite longer time to develop these antibodies and the reaction. So usually it is seen after 2 to 6 weeks of MI. So this is the second differentiating feature. What will be the treatment for pericarditis pain? It will be high dose aspirin. Roughly about 650 mg 3 times a day we need to give. Whereas for Dressler syndrome, again we can utilize high dose aspirin, even colchicine, some 0.5 to 0.6 mg twice daily we can utilize, so that the immune cells motility will be inhibited. Here point to remember is, don't use glucocorticoids to suppress this inflammation, because it might impede the healing process of myocardial infarction which has happened, especially in the first month. Try to avoid glucocorticoids as much as possible. Hope you have understood this important concept. As I mentioned about the ECG changes in pericarditis, mainly this concave shaped ST elevation, like this it will be concave shaped ST elevation, which will also be seen in case of BER, benign early repolarization. So, if you know how to differentiate this ST elevation of pericarditis versus benign early repolarization, comment it, and I will be discussing the differences and how to identify each of these in upcoming video. Thank you so much.